Dr. Kevin Blau from Blau Family Chiropractic and Integrated Wellness. I'm here with Patricia Huggett with a topic that we are probably battling or struggling with right now. We're fatigued, tired, stressed, and we want to try to eat our way back into energy, right? And so today what we're going to do is we're going to talk about carbohydrates, and then we're going to talk a little bit about emotional eating, and then we're going to dive into carbohydrates. You may be dealing with gluten. And so Patricia's got some new information for us, newly, I guess, kind of certified or just completed a course in gluten, probably intolerance, and all that kind of goes around that. So I'm going to have you begin, Patricia, with the carbohydrate. It's a sugar, it's a complex sugar, right? And we tend to like that because sugar is our fuel, right? And we're at a time right now where there's uncertainty, we're worried, we don't sleep, things of that sort. So we find ourselves in an emotional little pit of sorts. And so we try to dig our way out, right? And so can you maybe describe a little bit about emotional eating? Maybe people don't know about that. They think they just kind of eat to live or live to eat, but we're emotional beings. So maybe you can give us a little heads up on recognizing what this is and how we can slip into that, and maybe how we can get out of that would be good.
Well, emotional eating involves eating when you're basically not hungry for another reason other than hunger. Eating is pleasurable. So when you're depressed or stressed, or sometimes even when you're happy, you will eat. But looking at the stress situation or the depression situation, if you're eating for that reason, then you need to deal with those feelings and not use eating as an out, because eating is not going to fix your feelings of depression or stress.
Yeah. Well, you know what I find, this is a thought that I've maybe talked about with you in the past, but I talk about with patients a lot. We tend to eat, especially when we celebrate, right? We celebrate. So I'm going to bring up the traditional birthday, the birthday cake, right? Or the ice cream and these things. And we do this because we're happy, excited, and this is just a part of completing that emotion, celebrating with people, ourselves, for whatever event it is. It could be a wedding, whatever it is. But we tend to find that those foods that we're picking are kind of comfort foods. It satisfies that emotion. It just intensifies it, maybe even. We're happy, so we're really happy. Now we're going to have a bunch of sugar, whether it be cookies or whatever it may be. When we want to cheer somebody up, we'll bake up some cookies, right? How often have we, here we're going to bring you a bowl of broccoli, when you're down, and no, we want to bring us up. So I've found, and this is a difficult thing to probably do in our culture, how do we change the culture? How do we change the way we celebrate, right? Because I think if we do that, we start tipping the scales and going, we don't have to have all the sugar. And I'm guilty of it. In our family, we do it as well. But, when you stand back and look at the big picture, maybe we change some of those foods that we do so we actually maybe feel better in an hour than feel like kind of down and out of energy and spent.
Well, sugar is pleasurable. That's why we like it. But sugar comes in many different forms, and some are better for you. So what you can do is do your research and find out which sugars are better for you than others. For instance, stevia versus even white sugar, or the substitute sugars like Equal or that type of thing. That's totally a chemical. So there's lots of options when it comes to sweet to satisfy that desire for sweetness.
Yeah. Well, and I found that, even in the realm of, hey, just grabbing a fruit is sugar, right? But there's a fiber in there, and that helps kind of calm down the push of sugar in our body so we don't get a big insulin response and then get a crash. later. Our world is going in a direction that's not good in that regard. Diabetic, pre-diabetic, insulin challenges and such. It's gonna kick our butt, sort of, and we're gonna see obesity and insulin-dependent people in not too distant future, and that's a challenge. So yeah, some good pointers on maybe feeding that little hungry beast there, that sugar, because sugar is addicting, right? A study I always like to talk about is they had mice, and they had three things laid out for them: cheese, cocaine, and sugar, and they went to the sugar. Out of all of those things, was more addicting than cheese and cocaine. So it's kind of you have to realize that. And a good book that I've read from Dr. Mercola was A Sweet Deception. If you ever want to read that, it's very interesting to see the challenges of of sugar. But we're gonna dive into a sugar, a carbohydrate. But there's other things with carbohydrates that can be a challenge as well. And we're going to talk about gluten. Gluten is a big buzzword right now. Gluten sensitivities, intolerance. Maybe you can sift through some of that and maybe help people understand what is gluten. That might be a place to start. What is it? Where does this all kind of start? And maybe why are we where we're at this time with gluten?
Well, it's a protein. It's a protein found in wheat, barley, and rye. Mostly people eat wheat. It's found in almost everything. And people eat it, sometimes 3 times a day: toast or Danish for breakfast, sandwich for lunch, pasta for dinner. So you can overload your body with that gluten. And the issue is that you're not eating your father's, or I should say your grandfather's or great-grandfather's wheat. Scientists have worked to choose different traits in wheat to change it over time to something that's more desirable. Gluten is really desirable when it comes to baked goods because it helps it stick together better and gives it that chewiness that you find in bread and in any kind of baked goods. What they've done with our current wheat, which is a dwarf wheat, they've doubled the amount of gluten. It's gone from 4% to 8%. And they've also created a very starchy, fatty carbohydrate in wheat. And wheat can also be addictive like sugar.
Yeah.
It's
so what
genes.
Yeah. So what kind of problems can gluten cause? I mean, what are these things that people talk about? Wow, I got this gluten thing, and what kind of how could I identify that I maybe have that kind of situation? What kind of things are out there that maybe buzzwords people might have heard before that are attached to this gluten challenge in our body?
Well, if we look at, there was a study done by the gluten guru, Alessio Fasano, who is a doctor that specializes in gastroenterology, which is the study of your gut. And he discovered that whether you're a celiac patient, and we'll talk about celiac a little bit more because it's a good place to start to get an understanding of what's going on in your body. He also looked at non-gluten or non-celiac gluten sensitivity. He looked at people who have no sensitivity to gluten. And then he looked at people who were in remission that were celiac patients. And the effect of gluten on your gut doesn't seem to be very different from one person to another. Certainly genetics plays a factor. And if you look at, let's just look at celiac. There's 1 in 133 people have celiac disease in the United States. It is based on your genes. It's an autoimmune disease. Autoimmune diseases come about by genes, an environmental irritant, or an environmental factor, and a leaky gut. the irritating factor or the environmental factor in a celiac patient is gluten. So with the genes, with the gluten, and with the leaky gut, you have that's what you have for celiac disease. So if you remove the gluten, it heals the leaky gut, and you no longer have the symptoms of celiac disease, where you are very uncomfortable. You have stomach pain. You may have bloating. You may have diarrhea. You may have constipation that a celiac patient experiences. And gluten can affect other autoimmune diseases. There are some thought that Hashimoto's thyroiditis also has a gluten component to it. But with every autoimmune disease, there's a gene component, there's an irritating environmental factor that ends up causing the leaky gut. Environmental factors can be anything from stuff that you use on your hair, your body wash, your lotion, things in the air that affect you, things that you eat, chemicals that you can end up encountering in food from the way processed foods are produced. Also can be medications, also can be vaccines. Environmental factors is a huge group and is complex.
Yeah, you know, it's interesting you talk about celiacs and autoimmune. Maybe people don't know what autoimmune means. It means their immune system is fighting itself, right? And so it breaks down the gut. And and this creates this leaky gut, which could be another whole discussion. But the point is, what I found, a lot of times you think of adults, but when you see this quite often in kids with ADHD and hyperactivity, they have a gut problem that needs to be cleaned up. Obviously, quit killing yourself by eating the stuff once you recognize that, but then you got to heal the gut, right? That's got to be healed over time. So this is a real challenge, because if you don't recognize that this is a problem, you keep doing it, right? And we crave it. That's the challenge. Actually, a lot of people go, well, I actually crave that. I like it. Well, that's probably a good idea to look into this and go, you probably have a sensitivity to that. And maybe in any food. I would go across the board and go, if you're craving this stuff, unless you're pregnant maybe, but if you're craving it, you may be having a sensitivity to it to some degree, and that may be shown as a skin irritant, like you can see it, skin irritations. Maybe you can go through a few things of what they could look for, like, okay, I'm eating gluten, and it's in a lot of stuff. Man, it's in ketchup, it's in grains, it's a binding agent is what it is, and it gives you that chewy taste that people like. It's really hard to bake and cook without it. In our traditional sense, if you look at traditional things, it doesn't hold things together like noodles or bread or things like that. But what are some things that you would look for, or people could look for and say, wow, I ate this food and I think I have a sensitivity?
Well, I did mention a few of those things: the stomach pain, the bloating, the gas, the diarrhea, the constipation, the typical, it can even be nausea, anything that, affects, that can come from your gut.
And skin, I find skin issues.
Skin's another thing, yeah.
And skin is just an extension of your gut, right? So it's kind of interesting.
Actually, it can affect your brain too, because once you have the leaky gut situation where anything that shouldn't pass through does into your bloodstream, then it can affect any part of your body, and you can have any kind of symptoms that could go back to your gut.
Yeah, I've heard people have problems with just like allergy symptoms, right? You can get a runny nose, you can get tightness in the throat, you can get eyes in the morning. You get up and they're all dry, and you can feel things from even the night before that affected you. So it's a pretty big deal for people. In my family, I have a few kids that definitely have a sensitivity, and as soon as they eat it, man, they're kind of maybe even grumpy the next day. You know, they're just irritable, and I use this chance to teach them. Go, well, how did you feel? Not good. You know, I have sleeplessness, I have fatigue, mental fogginess, shortness of breath. disorientation even, from eating this kind of stuff, and go, well, let's look back at what you ate and let's understand this, right? And go, maybe we shouldn't do that. Because over time, this wears you down. And in an autoimmune disease, it becomes more and more virulent. It's kind of like a bee sting. You get it once and it keeps adding. Your body doesn't forget this stuff.
Other stuff other than gluten that can cause some of the same problems are eggs, dairy, shellfish, soy. Those are some of the things that are highly allergic for people.
Yeah.
And allergy doesn't mean that you have anaphylaxis where you can't breathe. It can be stomach issues. It can be skin issues. It can be postnasal drip where you've got drainage in the back of, from your sinuses all the time. Everybody's different. So everybody has a different set of symptoms, and you're not crazy for having those symptoms and looking for, sometimes you have to be your own detective. The doctor's not going to find it for you. You're going to have to figure out on your own that you want to feel better, and you're looking for what's causing the problem and eliminating it.
So, people have these symptoms and maybe don't recognize it. What do you find most people do with these symptoms? Do they just try to cover them up, act like they're not there? Because there's a lot of people that have this, and chronically over time, that creates other problems in their body, not just, I have a problem with this food. You start having other organ functions. A good example is you could become depressed, irritable, mental like fogginess, brain challenges, and people think they're going crazy. They don't know what's going on. Now, what do you find, like, I'm going to say over the counter, what do people do? What do they kind of reach for as trying to be their own doctor? What do you find people do first?
Well, it depends on the symptom. A lot of people will reach for an antihistamine if they're having, dry up their nasal passages. If you have an upset stomach, you're going to run for Tums potentially, or something like that to settle your stomach. You may end up going to your doctor and he throws a pill at you. And you're masking the symptoms. You're not getting to the root of the problem.
Right. Well, so then, this is what most people do. So I guess, what is the first step for a person that may think, hey, I have some sensitivities. I don't really know for sure. How do I know for sure? Do I do a diet plan, like what I eat? Do I mark it down and mark my symptoms? Do I get a blood test? Do I what should people do to maybe get the ball rolling so they feel confident and clear that this is what it is. It isn't something else. It's this. I need lifestyle changes. What would you recommend, maybe 2 or 3 things to maybe confirm for themselves that, yes, I have a problem with carbohydrates maybe to begin with, but even go one step further, the gluten that may be in other foods?
Well, the leaky gut, actually, in 2000, there is a blood test for a protein that indicates you have leaky gut, and also indicates that gluten has gotten through the door. Basically, your intestinal system is one cell thick, and these cells need to be held tightly together. And there are gates there where they allow things to go through, and they don't allow things to go through. But what can happen is that gate cannot function properly and not close completely. So that's when we get leaky gut. And there's a protein called zonulin that your body makes when you have leaky gut. So you can actually get a blood test that will tell you whether you have leaky gut or not. And then if you do, then you have to figure out what the cause is. Is it gluten or is it something else? That can be a tricky thing. Now, on the average person, I think the biggest thing that you have to do is recognize that you have a problem, and be willing to deal with it. Sometimes we have to be, not everyone wants to deal with their situation. I mean, not everyone who is overweight or is a diabetic. There's a lot of people who are in denial and don't want to deal with their situation. And so nothing happens. It really depends on you and what you want and what kind of, how healthy you want to be as an individual, and how important that is to you.
Yeah, and you can't, now, Patricia, you do like health coaching, right? And so, you have people that come to you. You obviously can't want it more than they do.
No.
Because so at a certain point, they have to be willing to be open to the possibility that something's happening. And maybe you can explain, maybe your take on, hey, somebody calls you up and says, hey, here's the deal. I need some help. I need some help with my weight. I'm a diabetic. I think I might be sensitive to gluten. Can you walk us through maybe what it takes for them to get to you? Like, okay, I'm going to come to see Patricia. I want to be the better version of myself, right? I want to be better than I am, and it takes effort, and my expectations are up here, but you got to do the work to get there. So maybe walk us through briefly what it takes to get to you and get to that commitment, because you're going to probably ask them to commit to something and somehow. So maybe give the listeners maybe an idea of what to expect if they need a little help, how you can help them weave through this little tangled mess.
Well, I'm going to be your coach. I'm going to be your personal trainer, just like you would have at the gym for health. And I'm going to talk to you about your situation. I'm going to want to know what you want to do, what motivates you, and what you want to achieve. Because I can't tell you what you want to achieve. You have to motivate it and want to do it. And you have to bear in mind that what you've been doing, you can't continue to do. You're going to have to make some changes. So you have to accept that and be willing to make those changes.
Is that a big jump? I mean, you just said that. That seems so easy to say, but that's kind of like the hard thing, It's like an alcoholic or anybody that's addicted to something. First, I have a problem, right? Okay, so we get that. We got to get. That's a big jump. If it was easy, everybody would do it, right? So that's difficult. That's why I'm here, to give hope and healing for people, to understand that there are people out there that can help you. If you don't know things, if you don't know what you're going through, then you go to somebody that does, because you're an advocate, right? You're an advocate for that person to be whatever they're missing in life, because most people don't do things because they're necessarily in pain or discomfort, because there's a lot of people that are in pain and discomfort. It's when it gets personal. It starts affecting your life. Hey, I can't leave the house. I irritable bowels. I can't leave the house anymore. I can't be social with people anymore, or whatever it may be. I can't play with my kids. I can't eat any food anymore. It seems like I'm eating one food, and that's all I can do. It's got to be better than this, right? And so we have to engage people in life-changing things. It's about their life, and the trajectory that they're going on is not where they desire to go, right?
Life change has to go about. You have to change your habits, but you have to approach everything with baby steps. Yeah. One little step at a time. You're not going to be able to change everything all at once. And to expect to change change your habits that you've been doing all of your life, you're not going to be able to change them overnight. You got to take little tiny baby steps and work at it slowly.
Yeah. And I found
them overwhelming.
Right. Yeah. Well, and I found that the challenge people have, and this is an important discussion, it's more than just about gluten, but this is a problem. But people that come to you, or maybe even to myself at a chiropractic office, they've been dealing with this for a long time. long time. And so their expectations are, I just want to be done with it like 5 years ago, or 10 or 20 years ago, or it's not present time, it was like a long time ago. And so their expectations are high, like this is where I want to go to, but you're not going to reach the level of your expectations. And I use this analogy, you'll fall to the level of your training, right? You'll fall to the level of the work that you're willing to do to get it done. And this is where the rubber hits the road when they're consulting with you. I'm just going to guess, hey, now these are the problems, these are the challenges. This is what we need to do. The key is I'm here for you, but you got to do the work. I'll help direct you. Have you experienced that? I mean, you've been in nursing for many years. You've been around patients. I want people to know that you have experience. This isn't just, I'm deciding to do this. You've been doing this for a long time around patients, chronically ill. You've seen it. And it's not the direction you see the future going in a healthy way. So you're wanting to make a difference. Maybe speak to what maybe people are going to have to deal with emotionally if they find out that gluten is an issue. There's an emotional tie to this. We started this whole thing off with eating with emotion. It's on the other end as well. Maybe you can speak to what patients may be going or people may be going through that you're coaching, the ups and downs.
Well, if you look at just celiac and you look at basically the average diagnosis, the time to get a diagnosis for celiac can be as long as 10 years. So you look at how long that person's potentially suffered with something that they've gone to potentially many doctors for, and the doctors haven't tested them for gluten for celiac. So they get frustrated and they see a lot of things happening, and they don't think they're crazy, but yet they're maybe it's been suggested that maybe they need to go see a psychologist or something, that it's all in their head when they know it's not. So that's the frustrating part as a nurse and being part of the standard healthcare system in the United States is we approach things from not figuring out what's causing the problem, but like they do in chiropractic and functional medicine, but they throw a pill at it and everything needs to be labeled with a diagnosis. And you are going through and not finding out what's causing your problem. And that's key. You can't fix it unless you know what it is. Yeah. And a pill doesn't fix it.
Yeah. And it's a challenge. And I know I talk about this often, in the, what we call the allopathic model is our mainstream medicine is treating symptoms. We want to be out of pain, right? That's kind of the deal is if we're out of pain and we've stabilized you, that's cool. But we've missed the boat on what is causing that. And so that might be a lifestyle change that needs to occur. I even tell patients when they're here, if you keep doing what got you here, that's what's going to keep you here. You got to change. There's got to be a change. And that starts with a choice, right? And as you change, as you make better choices, you're going to create better habits, right? So that's kind of the key with that. So, and maybe you found that to be the case as well.
Yeah.
It gets frustrating, and probably why you're in the position you're in right now, right? Trying to help people naturally, right? As best you can.
Right, because you can find the root cause and you can fix it. In a lot of cases, I mean, there's if you have a broken bone, it's got to be set, and that's where Western medicine is super good at. But when it comes to chronic diseases, chronic problems, pills don't always work there, and that's where lifestyle changes and diet are huge.
Yeah, and I think really this is kind of interesting. Now we're going to date ourselves right now, but that's okay. We're at a time where we got this corona virus or COVID time, right? We should be speaking about lifestyle changes, how we can help boost our immune system, create more peace, to down-regulate some of these things that would create anxiety, more exercise, getting rest, drinking water. I'm going to say get chiropractic care, modify the eating, the emotional eating that they're going to be going through. All of those things reduce the immune system and cause us to be more vulnerable, right? That's kind of the big word right now is vulnerable. Are you vulnerable? Are you the one that's vulnerable? So I think I encourage people to look into avenues like yourself, Patricia, where you can get help. If you feel like you're alone, I've I've found and patients have found, you can go on the internet and get a lot of information, and they'll come to me and go, wow, what's the truth? Is this gluten for real? Is this just a ploy to sell a bunch of gluten-free stuff to people, or is it real? Well, I guess, you know, if they're asking the question, they might be a candidate, right? Because they might be having symptoms, and then in their search, they're finding some portions of the truth, but maybe not the whole.
Well, with gluten sensitivity, you don't have the changes in your gut that you do with celiac. With celiac, what happens is your villi, which are like fingers in your gut, where the nutrient absorption happens. With that, with the celiac, those fingers go away.
Yeah.
So you can't have, you're actually malnourished.
Yeah.
You're not getting your nutrients. With gluten sensitivity, there's supposedly 18 million people who have a gluten sensitivity issue, and there's hundreds of symptoms, but they don't have the gut changes where your cilia are
Right.
your villi are messed up.
Yeah.
So
that's the challenge, and I think and unfortunately, going to your medical doctor or primary care physician, many times they're not equipped to understand that. They're equipped to see symptoms, and we're going to down regulate, or we're going to get rid of symptoms. You really need to look into it. So, I mean, what would you encourage people to do if they go, wow, you know, I don't know, do I have celiacs? Do I have leaky gut? Do I have some gluten sensitivity? Do I have a sensitivity to something? Whatever it may be. What are some things that maybe they can kind of just get started? Let's say not seeing you yet, but they're just thinking they might have a challenge. How might they feel more confident that it is? Is a food journal, a diary, a way to start?
Yeah, you could definitely look at what you eat on a regular basis, because what you eat on a regular basis may be what's causing your problem, because that's what you like.
Mm-hmm. Yeah.
Some of that, you may have to actually make some changes in what you're eating. For example, like I said initially, if you're eating toast for breakfast and a sandwich for lunch and pasta for dinner, that's all wheat.
Yeah.
And you might be thinking, oh no, if I'm gluten sensitive, what am I going to eat? Because all I eat is wheat. Hey, there's a lot of stuff out there that you can eat. Fruit, vegetables. There are other grains that you might be able to tolerate. Quinoa, wild rice. Rice.
And so, and maybe they'll be able to understand if they remove some of that and notice symptom changes by just doing that. Might be a sign for them. But would you say if they have those things like a sensitivity, celiacs or gluten sensitivity, do you think it's a good idea to get some coaching? I mean, you might probably say yes, but maybe adding value to understanding, because that's a big change, to change the way you eat, because most people eat probably 12 different meals in the week. They don't change much. From 12 to 15 is what I've read, and you just keep cycling through those same meals all the time, and you need to find alternatives or replacements. Is this something that you would help people with doing to try to understand what that might be, how it might look different, how they might maybe have some nutritional support possibly to help with their gut to restore that? Is that something that you do with coaching?
Yeah, I mean, we can look at what you're eating and give you other suggestions. A little bit of it you have to be a little bit adventuresome. I mean, some people are very adventuresome. It's like you say, they eat the same 10, 15 meals and that's it. There are a few foods that they like. Are you willing to try something new?
Right. Well, it's whether it's important enough to them, right?
Exactly.
If they want to change their life, they'll make the change. So what I wanted to do as I kind of wrap it up, I think you gave us some good information for people to think about, to try to understand and wade through this gluten thing. And really, it's kind of a gut thing. I mean, we kind of talked about many things with the gut, and we could probably do another whole class on that. But what are you kind of offering right now for people? You had mentioned earlier to me off the show here that you have a capability for people to jump on a Zoom with you and can get some coaching either individually or groups. I guess maybe you can explain what that looks like.
Well, certainly our first encounter would be a free one where we would just explore what you want from your health, what you want to change, or what problems you feel you have and you don't know where to go. That's what we would do initially, and that would be a free consultation.
Okay, great. So what I'm going to do is we'll have your contact information at the end of this video here. So if people want to contact you and get an understanding of how their lifestyle can be changed, or if it needs to be changed, I guess we don't know until you check it out. But if this is an important thing, because if you don't make the changes on your own, you need help, right? And most of us are kind of lost in that. Like I said, I see patients all the time. They don't know. They ask very innocent questions and don't know where to start. What's the truth? What's not the truth? And I'm sure you can help them wade through that.
Well, and sometimes people don't even know what questions to ask.
Yeah.
So, if you have somebody who has experience with it, they can help you with questions. They can answer questions you don't even know you have.
Yeah. You don't have to learn the hard way. That's all I'm saying. You don't have to learn the hard way. Many of you out there maybe have been suffering, like you said, 10 years before you can get a diagnosis. That's a lot of suffering and pain for you, your family, and people around you. So you don't have to suffer. That's the point. There is hope and healing. I say that all the time in chiropractic, but naturopath is a very complementary thing, because this deals with lifestyle changes that need to happen in your body, and you need to fuel your body properly for it to respond properly. And if you're into getting a change and changing what matters in your life, your health and healing, I encourage people to check out Patricia Huggett at her information we'll have at the end. I appreciate your wisdom. We just barely scratched the surface. So if you want to learn more, get a one-on-one with her. It's free. I always say it's worth saving up for. So go for it. And you can't lose there, and you can only gain. Hope to have you back again, Patricia. This is Dr. Kevin Blau with Blau Family Chiropractic and Integrated Wellness, focusing on what matters, hope and healing for our community, individuals, and families. Appreciate it. We'll see you next time.